I'm Alex. Mark to have you here. Your health comes first. If you've got any questions, just drop them. Let's begin this.
Heart disease refers to a range of conditions that affect the heart's structure and function. It includes problems like blocked blood vessels, coronary artery disease, irregular heartbeats, arrhythmias, heart defects present at birth, congenital heart disease, and problems with the heart's valves or muscles. It is one of the leading causes of death worldwide and is often linked to lifestyle factors such as poor diet, lack of exercise, smoking, and stress. Early detection, treatment, and lifestyle changes can help manage or prevent heart disease. Every night, our bodies display signals that may indicate the onset or presence of heart disease. Understanding these symptoms can lead to early detection and potentially save lives. This critical guide highlights 7 specific nighttime symptoms linked to heart-related risks, supported by groundbreaking medical research. Listen to your heart. Here is the 7 crucial nighttime symptoms you ignore daily. 1. Shortness of breath while lying flat, orthopnea. Struggling to breathe unless propped up on multiple pillows. Underlying cause: the inability of the heart's left ventricle to pump blood efficiently. This leads to fluid buildup in the lungs when lying flat. Key findings: recognized as a strong predictor of left-sided heart failure. Studies from Paradigm HF and Paragon HF trials confirmed orthopnea is a critical indicator of deteriorating cardiac function. Takeaway: adding more pillows over time may be a sign of worsening heart health, often mistaken for aging or weight issues. 2. Frequent nocturnal urination, nocturia. Waking up multiple times at night to urinate, despite minimal fluid intake before bed. Nocturia disrupts sleep and signals early. Underlying cause: fluid redistribution at night as retained fluids during the day are processed by the kidneys. Key findings: strong link to heart dysfunction identified in the Journal of Cardiac Failure. Takeaway: many try to combat this by drinking less water, inadvertently worsening their condition due to dehydration's added stress on the heart. 3. Night sweats without fever. Waking up drenched in sweat with no clear reason like heat, fever, or exertion. Underlying cause: autonomic nervous system dysfunction as the heart struggles to pump blood efficiently. Key findings: associated with silent myocardial ischemia, particularly in diabetic patients. Night sweats may indicate reduced oxygen supply to the heart during rest. Takeaway: often misunderstood or dismissed as hormone-related or stress-induced, night sweats can highlight cardiac distress needing urgent evaluation. 4. Waking up gasping for air, paroxysmal nocturnal dyspnea or PND. A sudden sensation of suffocation during sleep that forces you to awaken, often with a racing heart. Episodes become progressively severe if untreated. Underlying cause: severe fluid accumulation in the lungs due to a failing heart. Key findings: strongly associated with heart failure, as highlighted in the cardiovascular health study. Takeaway: even a single PND episode should prompt immediate medical consultation as it signals advanced cardiac stress. 5. Chest discomfort during sleep. Persistent tightness or heaviness in the chest while lying down, often misinterpreted as indigestion or anxiety. Unstable angina often appears at rest, not during exertion. Underlying cause: reduced blood flow to the heart muscle, ischemia, due to narrowed arteries exacerbated during rest. Key findings: common during silent heart attacks, especially in diabetics or older adults. Takeaway: subtle nightly chest pain could be the heart's plea for help. Immediate evaluation is necessary to rule out serious issues like coronary artery disease. 6. Severe snoring or sleep apnea. Loud snoring, punctuated by periods of stopped breathing, leaving you fatigued during the day despite sleeping. Underlying cause: repeated airway collapses lead to drops in oxygen levels and surges of stress hormones. Key findings: research links sleep apnea directly to cardiovascular disease, with significantly higher risks of sudden cardiac death. Episodes cause chronic inflammation, atherosclerosis, and sustained blood pressure elevation throughout the night. Takeaway: untreated sleep apnea accelerates heart damage and increases the likelihood of stroke and heart attacks. 7. Insomnia or restlessness at night. Difficulty falling or staying asleep, often accompanied by racing thoughts and a pounding heart. Underlying cause: overactivation of the sympathetic nervous system, leading to elevated stress hormones and cardiovascular strain. Key findings: chronic insomnia raises the risk of cardiac disease by 45%, as shown in meta-analyses in the European Journal of Preventive Cardiology. Sleep disruptions accelerate cardiovascular aging and plaque accumulation in arteries. Takeaway: insomnia is more than a modern inconvenience. It may damage the heart and fast-track cardiovascular events. Prevention basics: regular exercise, 150+ minutes weekly, heart-healthy diet, fruits, vegetables, whole grains, lean proteins, maintain healthy weight, don't smoke, manage stress regular, checkups for blood pressure, cholesterol, and blood sugar. Medical tests for early detection. If these symptoms sound familiar, early intervention is essential. Recommended diagnostic tests include echocardiogram, evaluates heart function and detects abnormalities. BNP or NT-proBNP blood tests, detects heart failure months before evident symptoms. Sleep studies, identifies obstructive sleep apnea and its effect on cardiovascular health. Ambulatory blood pressure monitoring, tracks nighttime blood pressure patterns. Stress test, unveils hidden coronary artery disease under stress. Electrocardiogram, ECG, identifies irregular rhythms or prior heart damage. Your heart communicates its struggles through nighttime symptoms. These may include orthopnea, nocturia, night sweats, PND, chest discomfort, sleep apnea, or insomnia. Listening to these warnings can save your life. Heart disease caught early is manageable and often reversible, but neglecting the signs leads to severe consequences. Prioritize your heart health. Don't dismiss these critical signals. Take action now. Thanks for watching and subscribe now and take control of your well-being, the smarter way.